When it comes to taking care of your health after 50, most men will think of their heart, their blood pressure, or maybe their cholesterol. But one part of the body that often gets overlooked is the penis. And here's the truth. The penis is like a health signal. The way you take care of it can reflect what's happening in your entire body. If circulation is weak, if hygiene is ignored, or if lifestyle choices are poor, the first signs often show up right there. That's why today we're going to dive into some practical, straightforward ways you can care for your penis every single day. Now, let's start with something basic but powerful: daily hygiene. It sounds simple, but many men underestimate its importance. Good hygiene prevents irritation, infections, and discomfort. If you're uncircumcised, that means gently cleaning under the foreskin with warm water. Soap isn't always needed there because harsh products can dry out the skin, but rinsing properly is key. If you're circumcised, cleaning is still important, especially around the base, where sweat and bacteria can build up. Why does this matter so much? Because poor hygiene can lead to inflammation. And inflammation in that area not only causes discomfort, but can even affect sensitivity over time. The next essential step is circulation. Blood flow is what makes everything work properly. Without strong circulation, erections become weaker, sensitivity goes down, and intimacy suffers. And circulation isn't just about sex. It's about keeping tissues healthy, oxygenated, and functioning. So, what can you do to keep blood flowing well? One of the simplest things is movement. Sitting too long, whether at a desk, on the couch, or in the car, slows everything down. Getting up to stretch, walking daily, or doing light exercises like squats or even calf raises helps pump blood not only to your legs, but also to the pelvic region. And remember this: what's good for your heart is good for your penis. Which brings me to lifestyle choices. Let's talk smoking. Smoking damages blood vessels, narrows arteries, and decreases nitric oxide in the body. Nitric oxide is a natural chemical your body produces to help blood vessels relax and widen. Without it, erections are harder to achieve and maintain. Quitting smoking is one of the best decisions you can make for penile health. Alcohol is another big factor. A drink here and there isn't usually a problem, but heavy drinking affects hormones like testosterone, dulls nerve sensitivity, and weakens circulation. So moderation really is the key. Speaking of testosterone, this hormone plays a role not just in sex drive, but in overall energy, mood, and muscle strength. After 50, testosterone naturally declines, but lifestyle can make that drop steeper or smoother. Poor sleep, too much stress, and lack of physical activity all lower testosterone levels faster. And when testosterone dips, circulation and sensitivity often follow. That's why small daily changes like aiming for 7 hours of sleep, reducing stress with breathing exercises, and keeping an active lifestyle directly protect penile health. Another point that many men overlook is skin health. The skin of the penis is sensitive and can easily get irritated by harsh laundry detergents, perfumed soaps, or even tight clothing that traps sweat and bacteria. Wearing breathable cotton underwear, avoiding overly tight pants, and keeping the area dry after showers are simple but effective ways to prevent irritation. If you've ever noticed redness, itchiness, or dryness, chances are it's from skin irritation rather than something more serious, but ignoring it can cause bigger issues. Now, here's something interesting most men don't realize. The penis depends heavily on the health of your pelvic floor muscles. These are the muscles that support your bladder, bowels, and sexual function. Weak pelvic floor muscles can lead to problems with erections and even bladder control. A simple exercise to strengthen them is called a Kegel. It's the same movement you use to stop your urine midstream. Practicing this a few times a day, holding for 5 seconds and relaxing, can make a huge difference in circulation and performance. Let's also address one common mistake men make, thinking that problems in this area are just part of aging. While age does play a role, most problems are actually linked to lifestyle factors. High blood pressure, diabetes, obesity, and smoking are the leading causes of erectile issues, not age alone. That means taking care of your penis is really about taking care of your overall health. So, in summary for this first part, daily hygiene, strong circulation, and lifestyle choices are the foundation of penile health. Keeping the area clean, protecting blood flow through movement and heart-friendly habits, avoiding smoking and heavy drinking, caring for skin, and strengthening pelvic floor muscles, all of these are simple but powerful steps, and the good news is every small change you make in these areas pays off not only in penile health, but in energy, mood, and overall well-being. And stay with me because in the next part, we're going deeper into what you eat, how hydration affects sensitivity and circulation, and the role of hormones in keeping everything working as it should. Now that we've laid down the foundation with hygiene, circulation, and lifestyle choices, let's shift into something just as important: nutrition, hydration, and hormones. Many men overlook how what they eat and drink affects their penis. But the truth is, the body works like a connected system. When the fuel is good, the performance is good. When the fuel is poor, problems show up quickly, especially after age 50. Let's start with nutrition. Your penis, just like your brain or your heart, depends on strong blood vessels and nerves. Foods that damage blood vessels, like processed meats, fried foods, or high-sugar snacks, hurt more than just your waistline. They directly reduce blood flow to the pelvic region. On the other hand, foods rich in antioxidants, healthy fats, and vitamins do the opposite. Think of foods like salmon, walnuts, spinach, berries, and olive oil. They improve circulation, reduce inflammation, and keep testosterone at healthier levels. One key nutrient for penile health is zinc. Zinc plays a role in testosterone production and in sperm health, but it's also important for immune function. Oysters, pumpkin seeds, beef, and chickpeas are all rich in zinc. Another vital nutrient is magnesium, which supports healthy blood vessels and muscle relaxation. Foods like almonds, spinach, and dark chocolate are great sources. Then there's L-arginine, an amino acid found in nuts, seeds, and turkey. It helps the body produce nitric oxide, the same molecule that allows blood vessels to relax and brings strong circulation to the penis. Now let's talk hydration. Many men don't realize that even mild dehydration can reduce sensitivity, lower energy, and make erections weaker. Why? Because blood is mostly water. When you're dehydrated, your blood volume goes down and circulation weakens. Plus, dehydration thickens the blood slightly, making it harder for it to flow freely. That's why aiming for 2 to 3 liters of water daily is a game changer. If you're drinking coffee or alcohol, which both dehydrate, then water becomes even more important. One simple trick is to keep a glass of water by your side throughout the day. Your penis and the rest of your body will thank you. Moving on, we can't ignore the role of hormones. Testosterone is the big one, but it's not the only player. Cortisol, which is the stress hormone, can be just as important. High cortisol levels from constant stress block testosterone production. That's why stress management isn't just about feeling calm. It's about protecting your hormones and your sexual health. Breathing exercises, meditation, walking in fresh air, or even listening to calming music lowers cortisol and allows testosterone to function better. Then there's insulin, the hormone that controls blood sugar. When men eat too much sugar or refined carbs, insulin spikes too often. Over time, this leads to insulin resistance, which is closely linked to erectile dysfunction. In fact, diabetes is one of the strongest risk factors for penile problems. That's why balancing blood sugar with steady meals, whole grains, lean protein, and vegetables makes such a difference. It's not just about avoiding diabetes, it's about protecting nerve function and blood flow in the penis. Another important part of hormone health is sleep. Men often think of sleep as rest time, but it's actually when the body repairs itself and balances hormones. Testosterone is mainly produced during deep sleep. So when sleep is cut short, maybe from stress, late night TV, or scrolling on the phone, testosterone levels fall. Studies have shown that men who consistently get less than 6 hours of sleep per night have significantly lower testosterone compared to those who get 7 to 8 hours. So protecting your sleep is protecting your hormones, your energy, and your penis health. Now, let's connect this to something practical: weight management. Excess belly fat is not just an appearance issue. Fat tissue actually produces an enzyme called aromatase, which converts testosterone into estrogen. This means that the more belly fat you have, the more your body robs itself of testosterone. That's why losing even a small amount of weight around the waistline can dramatically improve energy, testosterone, and circulation. Even 10 or 15 pounds off can make a noticeable difference in function and confidence. I also want to highlight something many men ignore: medications. Some medications prescribed for blood pressure, depression, or cholesterol can affect erectile function and sensitivity. This doesn't mean you should stop taking them. That could be dangerous. But it does mean you should talk to your doctor if you notice changes. Sometimes a small adjustment in dose or switching to another option can make a big difference. Remember, protecting your penis health is about open conversations with your healthcare provider, not silence. So if we put this together, what have we learned so far? That caring for your penis goes way beyond the surface. It's not only about hygiene, it's about what you eat, how much water you drink, how you sleep, how you manage stress, and how you treat your body as a whole. Every healthy choice you make shows up in stronger circulation, better sensitivity, and improved confidence. But don't go anywhere, because in the next part, we're going to get into something most men shy away from: specific habits to protect long-term function, prevent common conditions like infections or prostate issues, and keep intimacy strong well into later years. These are the practical, day-to-day tips that pull everything together, and I promise you'll want to hear number 10. So far, we've covered hygiene, nutrition, hydration, hormones, and lifestyle. Now let's bring everything together with 10 clear, practical tips that every man over 50 can start using today to care for his penis and protect long-term function. Some may surprise you. Some may seem simple, but all of them matter more than most men realize. Tip number 1, keep the area clean, but don't overdo it. Daily washing with warm water is usually enough. Using harsh soaps or scrubbing too hard can dry the skin, cause irritation, and even create tiny cuts that make infections easier. A gentle approach is always better. Tip number 2, wear supportive but breathable underwear. Tight, non-breathable materials trap heat and moisture, which encourages bacteria and fungi. Cotton or moisture-wicking fabrics are best. They keep things cool and comfortable, reducing the risk of rashes or infections. Tip number 3, protect your circulation. This means moving your body every day. Even walking for 20 to 30 minutes improves blood flow to the pelvic region. Sitting for too long can compress blood vessels, so standing up, stretching, or doing light exercises makes a real difference. Remember, circulation is the lifeline of penis health. Tip number 4, don't ignore prostate health. The prostate sits just below the bladder and plays a huge role in sexual and urinary function. An enlarged prostate, also called benign prostatic hyperplasia, can cause weak urine flow, nighttime urination, or even discomfort during intimacy. Regular checkups with your urologist help catch problems early. Staying ahead of prostate issues means protecting overall penile health. Tip number 5, stay hydrated and keep your urinary tract clean. Water doesn't just improve blood flow, it flushes out bacteria and helps prevent urinary infections. Older men are more prone to urinary issues, so water is one of the simplest but most powerful tools you have. Tip number 6, pay attention to medications and supplements. Some blood pressure drugs, antidepressants, or cholesterol medications may affect erections or sensitivity. Always talk to your doctor before making changes, but don't be afraid to ask about alternatives if you notice new symptoms. And when it comes to supplements, stick to evidence-based ones like vitamin D, zinc, or omega-3s, instead of unverified pills marketed as enhancers. Tip number 7, practice stress control daily. As we discussed earlier, stress raises cortisol, which lowers testosterone and blocks normal function. Deep breathing, stretching, hobbies, or simply stepping away from the phone can lower stress and bring your hormones back into balance. The calmer your mind, the healthier your body performs. Tip number 8, don't be afraid to exercise the pelvic floor. Just like any other muscle group, the pelvic muscles benefit from targeted training. Kegel exercises are simple contractions that strengthen the muscles supporting the bladder and penis. Strong pelvic floor muscles improve control, sensitivity, and circulation. Doing them a few times a day pays off in the long run. Tip number 9, protect against infections and injuries. Cuts, friction, or unclean environments can all increase the risk of problems. Keep nails trimmed, avoid using sharp tools in the area, and always treat even minor injuries with care. Infections can spread quickly if ignored, but they are easy to prevent with basic attention. Tip number 10, schedule regular checkups. Many men avoid the doctor until something goes wrong, but prevention is far better than cure. A quick visit once a year can check your prostate, hormone levels, blood pressure, and circulation. These small checkups often catch problems before they become serious. Think of it as routine maintenance, just like taking care of your car. You're protecting something even more valuable, your health and independence. Now, you might be wondering, do I really need to follow all 10 of these? The truth is yes, because they work together. Cleaning without managing your stress won't solve the problem. Exercising without eating right won't give you full results. Just like a chain is only as strong as its weakest link, your penis health depends on how you care for your whole body, not just one part of it. And here's something powerful to remember. Caring for your penis is not just about physical health, it's about confidence, relationships, and overall quality of life. When you know your body is working well, you walk taller, you feel younger, and you connect better with the people around you. Health is never just physical, it's emotional, social, and mental too. So as we wrap this up, let me ask you, which of these tips are you already doing, and which ones are you ready to start today? Maybe you'll begin by drinking more water, or maybe by scheduling that overdue checkup. The important thing is to start. Small steps done consistently lead to big changes over time. And before you go, I want to remind you, if this video gave you valuable insight, hit that like button, subscribe for more advice straight from a urologist, and share this with a friend who could benefit. Sometimes the best gift you can give another man is knowledge that helps him live longer, stronger, and healthier. Take care of yourself, and remember, your health is in your hands.